worthy by design.
Hello there, it is such a delight that you joined us on today's edition of Worthy by Design, brought to you by Advent Cable Network Nigeria, ACNNTV. On this show, we focus on the journey from girlhood to womanhood and everything in between. I'm Iberichim. Welcome. Now, the World Health Organization has raised alarm over the fact that about 77% of Nigerian women use skin lightening products. Can you beat that? What's more, Nigeria ranks highest in the world with some of our African counterparts like Togo, South Africa and Senegal trailing behind in the whole bleaching business. Now, why do ladies bleach? Are there benefits we are not aware of, or the side effects are no longer life-threatening? Now, the topic of our conversation today is the menace of skin bleaching. To help us make sense of all of this is Dr. Nebugo Oyahiri. I have been rehearsing that name in my head. Did I get it wrong?
Yes, you did well.
She's a consultant dermatologist and physician at the National Hospital Abuja. It's so good to have you, ma'am.
Thank you.
And then I can't help but also notice the glow on your skin. Please, what cream are you using, like Nigerian women?
You have to come and consult first.
You know, that's what we do.
Yes.
Please, what cream are you using? And we don't know, is it, going to work for our skin type or it's not going to work for us? I think we should take it up from there. In determining the kind of skincare products we use, what should we pay attention to?
Okay, so first of all, you have to know your skin type. Because if you don't know your skin type, then you would use the wrong products. So, and how do you know your skin type? You have to go and see your dermatologist, ideally. Now, if you have headache, you go to the hospital. Don't you? If you have a tummy ache, you go to the hospital. The skin is the largest organ in the body, but it's the one we take the most for granted. If you have a skin issue, you rather go to see a quack or somebody that is unprofessional or not licensed or trained to take care of the issue. And I wonder why we do that, why we take our skin for granted.
A lot of people believe that some people were born with the talent. It was passed down from generation to generation, so they know what to do about your skin.
Well, genes also play a role, actually, in how great your skin will be. But even if you have the genes to have great skin and you're not using the right products or you're doing terrible things, then
you're going to damage it.
Yeah, you will have issues with your skin.
Okay, thank you for that. Let's get on to the whole skin bleaching. Okay, so we don't call it skin bleaching again. We call it lightening, toning, and there are several words
to modify
it. You don't call it bleaching.
They are all the same thing.
But what is that skin? The different names we give it.
Okay, so bleaching is actually using chemical substances or agents to lighten the skin or get an even skin tone by reducing the concentration of the melanin in the skin. So that is skin bleaching, and it's the same thing as whitening, it's the same thing as lightening, it's the same thing as toning. No matter how you try to funkify it or make it look less
damaging,
serious or less damaging, it's still the same process. You're still using dangerous things on your skin to achieve a whitening effect.
So what those products do is that they go straight to your melanin.
Well, I can't put it that way.
Okay.
Now, there are so many different kinds of products.
Okay.
And then all those products work in different ways to achieve the results that we see. Some go directly, melanin is a component of cells called melanocytes. So some inhibit the production of this melanin by the melanocytes, some inhibit some hormones that are responsible for producing the melanin in the melanocytes, some totally destroy the melanocytes altogether. So some achieve skin blanching through vasoconstriction. I don't want to go into the details, but there are different mechanisms by which these ingredients or these agents work to achieve that purpose.
Okay, so let's talk about some of the ingredients we should be wary of when we're buying skincare products?
Yeah.
Because some people just buy skincare products and you find they say, your skin is looking brighter. You say, it's the cream I bought, and they don't even know what the cream is made of. So what ingredients should we look out for? When we see it, we're like, that's a no-go area.
So the problem we have in Nigeria and in most African countries, other countries really, is that these products are not even listed on the bottles. These products, the concentration is not listed on the bottles. And they are improperly labeled or incorrectly spelled, or they're just not there. They're not written there. Now, these ingredients, don't get me wrong, I'm a dermatologist. We actually have conditions that require the use of these ingredients. Okay. So these ingredients are safe when used for the right purpose, at the right concentration, and by the right professional. They're actually safe. So I don't want to throw out a word out there and you say, or somebody misconstrues what I say and say this is not safe. It can be safe if used properly. But the problem is that most of the time the concentrations are too high and they are not safe for the skin. Or it's not even put out there that this is being used because somebody may be allergic to these ingredients without even knowing. So if you don't know what is there, how would you avoid it? There are so many ingredients we use. There's hydroquinone, there is mercury, cysteamine, topical retinoids, vitamin C, arbutin, azelaic acid, tranexamic acid, kojic acid. I could go on and on and on.
That's the vitamin C we know.
No, well, at what concentration? That's the issue. You get. So most of these ingredients were designed to be used to treat specific medical conditions, but people now start using it off-label for different things they're not supposed to be used for.
So, are they? Okay, before I go to asking the benefits of skin bleaching, let me ask: how do I know that I am doing something wrong? I'm using the wrong product or I'm using the wrong concentration. Since the issue is not the ingredient but the concentration, how do I know?
Okay, so in the first place, why do you want to bleach? Or why do you want to lighten your skin? I think that is even where we should come from, because to go and be using those products, you apparently want to lighten your skin. So why in the first place do you want to lighten your skin?
They said some movie rules, you have to be... some organizations you have to.
Yeah, some. Lupita, did she get the movie role that she got? I mean, it stems from, it goes back to our colonial times, that mentality that white is superior, the brown slaves or got better jobs, were paid better because they looked better. They were house slaves. They weren't field slaves, you understand? So it's that perception that being lighter is more beautiful, it's more attractive, it will get you better pay, it will get you more career opportunities. So if we don't start teaching our children, our sons, to treat women better, you don't have to whistle or catcall when you say light lady and boo a dark-skinned lady. We teach our daughters to appreciate their skin, to understand this is the way God made us, and we are made in His image. So why do you want to change? I joke with my patients. I tell them, if you're kneeling there and praying to God, and God sends an angel to come and help you, the angel will come back and say, I did not see the person though, because you are white now. And meanwhile, you were not made white. So it stems from that. Why do we even want to bleach? Before we even start talking about the benefits. Now, there are indications, like I've been saying, for treating what we call pigmentation. We call it depigmentation in dermatology. If you have melasma, if you have post-inflammatory hyperpigmentation, which could come from different things, I'm not going to go into that. If you have vitiligo, we can do that. If you have some scars, we also use depigmenting agents to improve the appearance. So there are indications for what to use, when to use it, how to use it, how long to use it.
Or if you don't know what is happening to your skin, then seek help.
Yes. First thing, you have to know your skin type. So you have to see your dermatologist in the first place. Okay, what's my skin type? what do I use? How do I use it? This is what I want to achieve. You understand? And then you can now take it from there. So if you have pigmentation, first of all, find out what type of pigmentation it is in the first place now. What is it? What is this thing on my face? Why do I want to remove it? How do I remove it? And it's so easy to do and achievable in the right way.
But someone say it's expensive.
To do what now?
To see
A dermatologist.
To see you
expenses. Money is relative. It depends. Money is relative. You see, by the time you go shopping from one place to another, spending money on these creams and not achieving
You have
results,
spent more.
you've spent a lot. You've spent more. You've just gone around and you still get back at, because when you damage your skin, you're still going to come and see me at the end of the day, when you should have seen me from the first point. So you asked the question, you said, what are those things you would know, like you're using a product and you know that, oh, this product is not good for me. So in other words, what are the side effects of these ingredients? There are so many, and it depends on what ingredient is actually in that product you're using. Some of them, for example, hydroquinone can cause what we call exogenous onchronosis, where you see bluish black depositions on the sides of the face. If the patient has been using it for a very long time, hydroquinone can actually cause what we call trimethyl amenorrhea. So you see that person smells like a fish when the person eats fish, seafoods and some other products, because these things is deposited and in the long run can even enter systemically. Mercury can cause acrodynia, which is painful hands and feet, and even cause what we call rebound hyperpigmentation or darkening of the hair, skin and nails at the end of the day. Steroids, which is in most of all these products, initially to make you light, oh, you'll be glowing, you'll be looking nice. Once you stop using that thing, everything will come back in full force. They cause steroid acne, they can cause rosacea, they cause thinning of the skin, they cause stretch marks, they worsen stretch marks. And then if you use them in the long run, they can also enter systemically, cause hypertension, diabetes, Cushing syndrome, so many issues from these things. And this is just a few that I have mentioned. So why even do it in the first place?
So it's not advisable
To bleach?
without okay let's say
You
it's
have
not
to have
advisable.
an indication now.
Okay.
What is the reason? Why are you bleaching?
So now you have talked about us coming to you for our skincare routine, so that we know that, okay, this is my skin type, this is what I need, this is what I need.
Yes.
Right? So at what point do you think a lady should make that decision? I need to see a dermatologist.
I think when you're aware that, oh, I have skin and I want to treat it, or I want to take care of my skin. You know, a lot of patients feel is only when you get to 40 or 50, you know, you want to start taking care of your skin.
Anti-aging.
Thank you. Using anti-aging products. But the truth is that anti-aging starts from the minute you are aware. We can get away with doing all those things we do. You don't bath in the morning, you do rub and shine, you don't use the right products when we're young, because our collagen is still there, elastin is still there. So many things. Our body is regenerative. It can take care of itself. But you have to, once you're conscious of, oh, I'm getting older, oh, I need to start taking care of my skin, oh, I need to start glowing, then you should see your dermatologist. But I'm still going to talk about free advice for people to have great skin.
Please, I'm listening.
Great skin starts from within.
Okay.
I always tell my patients that, see, you can buy the best products to use. If you're not happy, it's not going to show. If you're not content, it's not going to show. If you're eating the wrong things, it's not going to show. You have to do fruits and vegetables, you have to exercise, you have to drink water, you have to hydrate from within, you have to use sunscreen. If you're not doing it from within, from a great place, it's not going to show. So there are so many
From
things,
inside out.
Yeah, from inside out. It comes from within.
So how important is this change of perception? You know, earlier you had talked about African or colonial mindset, right? How important is this change of perception to the African woman?
Okay, so we need to first of all address it from the core issues.
Okay.
The reason that most people try to bleach per se is one, they don't feel they are beautiful enough.
True.
They don't feel they are pretty. They don't feel they are attractive. So it's from self-esteem. We have to train our girls to be proud of who they are, proud of their skin. We have to teach them to love themselves from inside. That's where it comes from. We have to address racism, which is where it also comes from.
True.
Because, I mean, you see a fair-skinned lady and a dark-skinned lady. Even though the dark-skinned lady is more qualified, you decide to give the job to a fair-skinned lady. That's some sort of racism.
True.
So that is what we have to address. We have to address our values as a society, our values in the home. If you are rewarding somebody that is fair-skinned over somebody that is dark-skinned, then it's wrong. So
Pepe.
thank you. So that is how. So it's very, very important. And if we can get it right from the home, I've always believed that, I mean, the home is the unit of the society. If we can get it right from the home, then it will balloon. It has a domino effect. It can spread out to the society at large. They say you don't judge a book by its cover. It's not about what is outside. It's what is inside that is important. It doesn't matter how somebody looks. It's what comes out of that person that is important. So that's why we need to address this issue to stop the dangers, the side effects, because, you know, the side effects that could lead to more issues in the long run. And I always tell my patients that bleach, you see your skin now, it looks great. Check yourself out in 10 years' time or 20 years' time. There is also the cumulative effect of using these bleaching creams. It's not now you may see the effect. It's when you're 40, when you're 50, when you're older that you see that, oh my God, I have damaged my skin in the long run. And we have to talk about, why was the melanin put there in the first place? Why did our God put the melanin there in the first place? We are this color because melanin is responsible for protecting us from the ultraviolet rays of the sun. The ultraviolet rays of the sun are very, very dangerous. They can cause aging. They can actually make you age faster. They can cause wrinkles. They can cause, what's it called? Skin cancers. So you want to go and remove your melanin or reduce the concentration. You therefore increase the risk of getting all these things in the long run. And then it can also cause pigmentation. So if you're not using the right products to protect you from, God has already given us our own natural sunscreen. That is the melanin. We have black and brown melanin. But we have to use other products to help our skin to blossom. Or to glow.
Right. We have just a few minutes to go. And I would want you to put all of this together. What would be your advice to ladies out there? As your doctor, I am telling you from my heart, give us the advice. And then end it with the issue of self-worth. Now, this program is about the worth of a woman. Tie it all together and let the lady out there pick something and go home with.
So, can damaged skin be reversed? Yes, it can. But it depends on the damage. It depends on the side effects you're dealing with. Most of the time, when products have been used for so long and the side effects, for example, is stretch marks. Stretch marks, there's hardly anything we can do about it. We can only improve the appearance. Now, for pigmentation, acne that comes from using these long products, then we have ways to treat it. For skin thinning, it takes a long time, you know, for the skin to regenerate or re-epithelialize, you understand? So most of the treatment involves long-term therapy. But yes, these things, most of them can be reversed. A couple of them can't though. Now, how do I tie it all up together? I tell my patients, I tell my daughters, you are beautiful, you are worthy, you are important. Nobody is better than you. If we can teach our young girls, our daughters that, and appreciate our friends, you know, appreciate ourselves as women, encourage ourselves. You see your friend looking lovely, what's that one doing? No.
Pay compliments.
Pay compliments, just like how the men do. Pay compliments to a dark-skinned lady. Pay compliments to your fair-skinned lady also. Compliment them. It boosts our confidence. It boosts your morale. And that will discourage whoever from from using those products. Then know your skin type. There's normal, there's dry, there's combination, there's oily, and then you have to use the products that are for those skin types. If you don't know your skin type, then see your skin doctor, see your dermatologist, so he or she can put you through what to do, what to use, you know. And then sunscreen. Oh my God, sunscreen, sunscreen, sunscreen. Great skin comes from within. You have to be happy. You have to be content. You have to appreciate yourself for who you are. You are made in God's image. So, I mean, you are God.
True, you are good.
Yes, so who can beat you? You have to have that confidence. Then, what's it called? Drink lots of water, exercise, fruits and vegetables. Don't let anything bother you. Stress can age you faster than anything. Apart from the sun, it can age you. So you do all these things and life will be easy. Your skin will glow.
Okay, so if you want your skin to glow like this beautiful doctor, take that advice. Now, your melanin is a blessing. So don't let anyone define your beauty in terms of your skin color. Embrace your complexion. Love it because you're beautiful. Rather, channel that energy towards causes that add value to you. Thank you so much, our beautiful doctor. Doctors are beautiful, Sha. Thank you for sharing your time with us.
Thank you.
Do join us again next week, same time, same station, for another thought-provoking edition of the show. Remember, you are worthy by design. Let's head to a quick fix segment. See you there.
Hello there, it's so good that you joined us on today's edition of Quick Fix. We're excited that you learned something new last week. Some wall decors involving the whole family. I'm sure the kids were so excited to have learned something new. Today, I still have in the studio my beautiful guest, and she is...
Chinazo Audio. It's good to be here again.
Thank you. And what do you have for us?
Well, we still have some paper decorations that can be used as wall decorations.
Okay.
We have these ones. They look like this.
Okay.
And something like this. It's basically just paper. You know, the last time we said we could use any type of paper, whatever is available to you. I think I said we could use newspaper. See, I used newspaper for this. It gives it its own look, you know, but
Rustic.
yeah, depends on what you want. You could color the newspapers, you can use them that way. So, but as usual, it involves paper, scissors, and glue, like I said. These are the main things that are involved. Then every other thing is just glue. Okay, today I'll be using, well, we could still use the normal glue, but I have uhu glue here. Then this particular one, this stick glue pad, this is what it looks like. This particular one is for uhu, but you can get any one you have. So this is what it looks like. It's a double, the gum is on both sides.
Okay.
So you attach it to the back and then you paste
On the wall.
Yes.
Oh, great, great.
But you can also hang. You can perforate and hang, but you know, it gives it, this one can be stuck to the wall, so you can do that.
All right.
So again, measurements, it depends on you. You can decide to just freestyle, but you can also decide to measure. So for this one, I think this is, let me confirm.
20.
Okay, 20 cm. 20 cm would be for the width. Length should be 30 cm.
Okay.
So for this, I'm using
20 by 30.
Yes. So you need two pieces. That's why I'm folding it into to cut. You can use scissors to cut, but I will use ruler.
Okay.
Yeah. Scissors, of course, will give you the finer edge. Ruler will give you this rough thing. We're amateurs, so let's
Okay.
fold it. So the idea is to fold it. You can see this is pleated, so it's just to fold. You can use a ruler and pencil to just mark and like maybe give space
For precision.
yes. But if you want to be fast or you're used to it. You can do it this way. I folded it in two. I fold it again.
Okay. Yeah.
Okay. Then I will fold it again.
That's how many times now?
This is
We're going to count. I have to give it a count.
This is what. No, this doesn't really matter for now.
Okay.
I'm just doing this so that I can get a form of pleats.
Okay.
And I will still open it up and take my time
To fold,
Yes,
okay.
so you'll be careful to know this paper now, the front and the back is not very clear. But if you have a paper that, for instance, this one that has a clear front and back, you'll be careful to make sure the one you want at the back is at the back.
Okay.
For instance, this is dull, so let's have this at the back. So I will fold it this way to cover the back. Then we'll go like that. I'm just using
Now it's decor.
like something else.
So, this is what it looks like.
Fold in two.
Okay, 2 equal parts.
Yes.
Okay.
Like that. You know, we folded
Yeah,
it,
okay,
so we're
okay.
holding the middle
Together.
together. Okay, before that, we have to hold this edge, this in the center, so that we're at the center.
Okay. So I think
That's
the gum will be tighter.
Yes, gum will make it more.
So you hold it again.
Yes, you hold this. You're joining the two of them together now. So if you're working with children, you know, because stapler is not so
Safe, right?
yes, you can actually just use gum. So I'll just use gum to hold this needle here. So that's it.
Look how easy it is to just get something new, some refreshing feel in the house. So simple.
Okay, so now we have the front and then the back.
Okay, so where are we putting the other glue, the stick-on glue?
Back, yes.
Okay.
So you can use, if you don't have this, you can use, there's a way they fold sellotape or masking
Okay.
tape. You can fold it so that it's,
But to have it lasting,
yeah, no, you know, this is not as common as
Okay.
the other one. Or there's this glue they use for balloon.
okay. Oh, okay,
Yes,
okay.
it's transparent glue.
Ta-da! Imagine having this way and this way in the children's room. So beautiful, right? Simple. Try it out and trust me, your children will thank you. That is how far we can go on to this episode of the show. I hope you learned something new. I hope you try that out. And Nazo, you have been more than amazing. Thank you for coming
so
on the
much.
show.
Thank you for having me.
Right. And Nazo can do it for you in case you don't have the time. She can try it out for you. So thank you until we come your way again next time. Remain worthy by design. Bye now.